Well, thank you. It's really been a rewarding journey over the last 20 years, uh, living out my purpose of making a difference for patients. I did join the Novartis as a director in medical affairs, and many things about medical affairs have actually stayed the same, which is the primary purpose, which is to scientifically engage with healthcare professionals and provide them with evidence that impacts their clinical practice as a means of adding value to patients. But three or four things have certainly evolved over the 20 years. So the first thing is, of course, the complexity of medical practice. So physicians now increasingly practice in complex health systems, so that a medical organization needs to have the ability to understand how patients are cared for in the health systems in their geographies. The second element that has changed is, of course, the importance of additional use of digital technologies and data. So while we generate evidence, we have an increasing proportion of evidence that is now being generated using real-world data sets. We are communicating with physicians using digital technology in means that they prefer, as opposed to the previous ways of doing things, mainly through publications. The third element is that there's a greater demand from society on making sure that we're doing things with transparency. There's a great expectation of us to be trustworthy, and that comes from a real commitment to making sure that we always do everything we do with integrity. These are exciting times for medical affairs, and I see us as being the core pillar that bridges between science and clinical practice and helps change the practice of medicine for patients. So when I think of the three key pillars that drive success in the role of a chief medical officer, first is the ability to bridge the science to clinical practice. So it is really important for a chief medical officer to be able to have a deep understanding of the needs of their key stakeholders, physicians, payers, and patients, and then be able to understand how the innovation in science is going to play out in the context of clinical practice. The second is a steadfast commitment to be the voice of those healthcare professionals and patients within the company. And the third is a very solid foundation of integrity to ensure that all that is being done with credibility and engenders trust from all our stakeholders. I think at the heart of all successful communication across multiple stakeholders is the commitment to collaborate and keeping in mind the primary purpose for which we are doing this collaboration. So keeping the patients in mind, the success in communication that I experience every day comes from, first, the commitment to understand each of the stakeholders and what drives their value proposition, looking for the common interest, and then aligning all of our actions towards the common purpose that we work for. Indeed, we are really excited about all of the transformation that is coming about as a result of advances in digital technologies, big data, and advanced analytics. In fact, these advances are impacting all aspects of our work in a pharmaceutical company. If we think of the life cycle of a drug through discovery all the way to patients, I can illustrate the impact that digital technology is having at various levels. In the discovery phase, technology is being used to advance and accelerate our ability to identify targets, to screen molecules, to use advanced artificial intelligence tools, to be able to simulate environments that might have otherwise taken much longer to address. We're able to understand the safety of products and predict it much earlier in the development stages. Moving on to clinical trials, as you might have heard, we recently expanded our collaboration with Science 37. The use of technology in order to facilitate more efficient trial conduct by going directly to patients and using technology to monitor them is an area that is having great impact, and we think that this will increase over time. When one thinks of a large operation of the many hundreds of trials that we run at Novartis, the availability of this large data sets from what we call the science of operations and using advanced analytics to identify sites that are going to perform well, to track performance on an ongoing basis, allows us to achieve greater efficiencies in the resources that we deploy towards these clinical trials, and then to target those investments towards additional innovation. When it comes to medical affairs and our interactions with healthcare professionals, we are using technology to modify and customize our interactions with people. We're now trying to find out how we can create much more customized and individualized approaches to physician education by providing content when they want it in formats that they prefer, so that we can maximize the impact. When it comes to evidence generation, we have now access to large real-world data sets, and using technology we are able to actually answer questions that are relevant to clinical practice far more efficiently than before, when we might have had to run very large and expensive prospective trials. So this impact is happening at all levels, and we are very excited about it, and I expect that this will continue to transform our industry in a major way. Indeed, integrity and credibility are the very foundation of the work we do every day. Society is expecting a lot of transparency in our engagement with physicians. They're also expecting transparency on the data that we collect and the results that our analyses reveal. Underlying this is a historical suspicion that perhaps pharmaceutical industry is not always as transparent as it should be. I firmly believe that transparency as a driver for doing the right thing is actually a little bit backwards. When you always begin with your purpose in mind and decide to do the right thing and always ask the question, is what we are doing in the interest of patients, then integrity is obvious